this Monday. A quick mention that all questions can be sent to the email that will be down in the chat or the Q&A box. Please refrain from sending them directly in there. Again, you can send all your questions directly to that email. It is also our pleasure to have and introduce our esteemed guests, starting with Black Mental Health Connections Montreal. So BMHC Montreal is a coalition of organizations and individuals focused on the mental health and well-being of the English-speaking Black community in Montreal. They work to promote a greater understanding of mental health as it pertains to the Black community, advocate for increased access to culturally relevant mental health resources, and promote prevention and daily care. Thank you, Kristen and Aisha, for joining us on behalf of your organization. Following with Miranda Potts, as an outreach worker for seniors in the N.D.G area, she works both for Prevention CDN-NDG and the N.D.G Senior Citizen Council. She is a founding member of WIN, as in the West End Intergenerational Network, as well as a current co-chair. She has been an advocate for vulnerable and marginalized persons in the West End area. Thank you also, Miranda, for being here. Next, we have Karl Thomas, an outreach worker who ran the Jeune Leader Project for 5 years, who's currently running the Sport Hazard Project. He also remains the employee liaison at Prevention CDN-NDG. Karl, we're really happy to have you here as well. Thank you for being here. Following with Nadine J. Collins. Nadine Collins is a community worker in N.D.G for over 11 years and the director of the St. Raymond's Community Center, Comité Jeunesse N.D.G. She's also the World Groove Movement Ambassador for Quebec and has created a workshop on topics related to joy and self-care. Thank you, Ms. Collins, for joining us as well. Now we have Myrlie Marcelin. On top of being a full-time graduate student in McGill's Couple and Family Therapy program, she holds a master's degree in social work. As a therapist in training, Marcelin focuses on using holistic approaches in private practice therapy for individuals, couples, and families with an emphasis on providing care for BIPOC clients. Striving to demonstrate that strong relationships can be developed between BIPOC communities and non-white therapists, she also dives into the impact of colorism, silent trauma, colonialism, minority stress, and racial discrimination. We're delighted to have you here as well. Next, we have Annick Flavien, a Black community advocate, a Black scholar, the founding coordinator of the Black Perspective Office, BPO, and a co-chair on the President's Task Force on Anti-Black Racism at Concordia University. She's a 3-time graduate at Concordia and has been working on campus for the last 10 years, where she had the opportunity to participate in and support many grassroots mental health, EDI, and anti-racist initiatives across campus. This has deeply informed her work and approaches in leading the BPO and its services. Thank you, Ms. Flavien, for being with us today. Lastly, and certainly not least, we have Dr. Myrlie Marcelin. Dr. Lashley is an assistant professor in the Department of Psychiatry at McGill University, as well as the adjunct researcher at the Culture and Mental Health Research Unit of the Lady Davis Institute for Medical Research. She's also an internationally recognized clinical, teaching, and research authority in cultural psychology and serves as an expert psychological consultant to institutions, including the juvenile justice system. She has also conducted training workshops locally, nationally, and internationally, and has acted as a consultant to the Brazilian healthcare system. She was a director of the Canadian Race Relations Foundation and has also served on the Comité consultatif sur les relations interculturelles et interraciales de la communauté urbaine de Montréal. Dr. Lashley, it is our honor to have you here.
Thank you very much indeed.
All right, so we would like to have each guest summarize their experience working with the realm of mental health and within the community. So what influenced your decision to go down that specific path? We could start with BMHC, Kristen or Alicia.
Okay, so I'll go first. So BMHC, my interaction with BMHC actually started from my own mental health journey. It took a lot of time, a lot of my own personal interest to get to where I am with, I guess, good mental health. And so I've joined BMHC as a way to smooth that journey for other people so that it doesn't take as much effort, as much time, as much individual exploration, I'll put it that way. to get to where I am and where I feel comfortable with expressing how I feel, expressing what my boundaries are, expressing when I need to take time and I need to take a day to rest and recharge, rather than just pushing ahead, which is something that I did previously. And I think Aisha's journey is similar, but I'll let her explain.
Yeah, so it's actually very similar to Kristen's. So like learning how to heal my own maladaptive coping with like trauma that I've experienced in my childhood and just from being like a racialized individual, you know, who is a cis woman, grew up in a lower socioeconomic standing. So it's like all these different facets of my identity have played into my mental health experience, and even just the path that I've taken. Like I learned there's so many barriers when it comes to like deconstructing the different impacts that our identities have on our mental health. And so like yeah, just like what Kristen said, is to like disseminate this information, because there is a huge barrier between like um, the communities that really need it, who are marginalized often, and the actual care that is relevant to them that could help them in their particular circumstances. And you'll see this a lot in the Black community. There's a huge stigma, and also just the fact that we don't really share about these experiences as much as, say, like other communities. And so, like, just sharing these resources, making people know that it's not as negative as it's been made out to be through colonization and others' interpretations of this marginalized community, but instead that like it is something that we should all take care of, just like our physical health, and like giving them resources and like accessible resources too, because like the paywall is very huge. So like making sure that people can access the care through like we have peer support groups, resources on our websites, even talking about it on social media and things like that. And we're always trying to develop more programs in order to make it so that people do have this access to care for their mental health.
Thank you so much. We're gonna follow with Miranda. If you have anything to say.
Yeah, I think I misunderstood the question when we got it, because I thought we were just we were going to just talk about our the work relation. I didn't know it was a personal thing. So I would just say I grew up. I obviously growing up here in the 70s in Montreal West. I grew up in an affluent area, but I was impoverished on welfare, and in a single parent home where that was also uncommon. And my mother was white, and there was no representation of the Black side of me, as my father and my relatives were in the States, and my Black side's on the American. So it's been an interesting road. I was very blessed to have good, solid mentors as well, just like Dr. Myrlie Marcelin from when I was a young girl, Clarence Bain. I did have some positive role models, but it's certainly been an interesting 50-year journey, and seeing the progression and the change within the community over the years as well. Through my work, I do work with mostly low income. So I do have people with, that's why, you know, exasperate into mental health issues. So I see it in many different areas within the Black community. Specifically, my role is really to try to reduce the stigma around seeking help and getting help. I've seen a lot, especially from Bill 21, the Law 21 starting here through the Trump administration. There was a lot of triggering with the older members of my community, in the Black community, and my clients who had lived through the civil rights movement. So it's been interesting, and it's quite a spectrum. I hope that answers something.
It really does. Thank you for that. We're gonna follow with Karl.
Yeah, just like Miranda, I understood the question like via your parkour, like the work parkour. But sharing a little bit of personal, I'm the story of the Black kid that grew up with no dad. So I had to find some sense of male role models. Unfortunately, where I grew up, we didn't really have that that aspect. So our role models were the people were basically the guys in the streets. doing or being up to no good. But within that sphere, I fell in love with the community aspect by meeting an outreach worker at the time named Kirby Sinat, and I don't know. I think he gave me a different lens. He showed me that you could be cool, but also like just being proper. Like it was all about being proper. Afterwards, my education was at Concordia. And yeah, so right now, if we're talking about the work aspect, so yes, I did, and I'm still doing, I'm 11 years in the community and 3 years in the CIRS with the DYP. So right now I'm seeing the aspect of both worlds, the aspect of where people call you because it's community. So people come to you seeking for help. And then I'm seeing the other aspect of it, the other side of it, where it's mandated. You have to go to people's houses to address certain issues. And a lot of it is based on mental health, which is surprising because in a government setting, we often don't talk about it as much. We try to assess situations by being very, very directive within the government setting. But I feel that community keeps me sane because it gives me leeway, it gives me, it gives me room to sort of approach and intervene in the matter of the client first. So right now I'm like seeing, like I said, both sides of it. And yeah, just like Miranda, I hope that answers the question.
It really does. It really does. Thank you so much. Now with Nadine.
Hello, everyone. Thank you so much for having me, and just amazing to be with all of you from Concordia and my colleagues for this important conversation. My background is I am a child of two Jamaican amazing parents. And of course, my journey in psychology was actually reading my older brother's books. He had all these books out and I said, psychology is so cool and so amazing. And my community journey actually happened when I went to Jamaica in Manchester. And my auntie is basically in charge of a boys' home. 29 boys who were either abandoned, orphaned, their parents weren't able to support them, et cetera, et cetera. And just seeing the impact that my auntie had doing these resources, activities, really inspired me to go into community work. And coming back to Canada and speaking with one of my mentors, which was Felicia Burke and Clarence Bain, Dr. Clarence Bain, with Quebec Board of Black Educators, then BCRC, Black Community Resource Center, and of course now with St. Raymond's Comité Jeunesse, N.D.G. I just think it's really important for us to know that, mental health, our self-care matters. We matter, we have value. And, being a person in darker skin, and going through life being traumatized, bullied for whatever reason, I think it's so important that we're having this conversation to really end that stigma and know that there is community care. And I think that is one of the things that's so important for me, is that community care. And the examples of Black joy. I really believe Black joy is so important. So yeah, that's a bit of my story. Thank you for asking.
Thank you so much. And now we're going to continue with Myrlie, please.
Okay, so I just want to say thank you, all of you guys, for having me here. It's great to share this with you. And I share everyone's sentiments so far. I hear a little bit of my own story and everything that you've all said so far. I come from two Caribbean or Haitian parents that, migrated here. Then we moved to Florida and then back to Canada. And I think that the way, growing up in a big family with a lot of siblings and being the middle child and having that kind of like a negotiating type of character that I have as the one in the middle, I always dreamed of, being there to help people with that kind of thing in the future. And it kind of just stuck with me. I've always found myself drawn towards understanding the mind, understanding behaviors, understanding human condition, and just trying to help people see the beauty in healing and in just doing things that help satisfy their life, make them happy. And I think that people can reach that when they do feel their mental health is at a better place. And I also grew up in a more suburban white area, and I felt the invisibility of Blackness and of people that look like me, people with our skin color. And I wanted that to change, and I wanted that disparity to get smaller and smaller. And I think that drove me to do this work. Right now, I'm at McGill's Couple and Family Therapy Clinic in the Couple and Family Therapy program under the supervision of Shirlette Wint and Dr. Heather McIntosh. And we're also working with Invisibility to Visibility Black Lives, Black Therapist Project, which is where I kind of got introduced to the BH-MC, and also work towards an emphasis on seeing more BIPOC clients to show them that it's possible to do individual therapy, couple therapy, and family therapy, and grow and heal from those environments that are safe and that allow us to talk about the things that we don't always get the space to do or talk about. And so that's really where my passion is lying, in kind of continuing to focus on that work. And I hope that when I graduate, I can continue to do that in private practice settings or wherever settings I'm needed.
Thank you so much for the introduction.
Thank you.
Yes, and now we're going to continue with Annick, please.
Thank you. Yeah, I guess, I mean, I was really born into a lot of this work. My parents are Haitian immigrants, and my mom was a school principal for many, many years, and my father was a psychiatrist. He passed when I was quite young, so I don't actually know that much about his personal parkour, but I was definitely raised in a home that talked about mental wellness, was really, really rooted in community. My mom was a foster parent and extremely active community member her whole life, and continues to be so right now. So I was definitely raised in that. And then many of my family members and myself have struggled with mental illness, finding a balance between mental wellness as well. And so that's definitely been in my personal kind of home life. And then in terms of the work that I do at Concordia and the Black Perspectives Office, it was really about reflecting on my own experiences as a graduate from Concordia, and how much dissociation Black students do in order to survive the university context, or to survive school in general. There's this need to kind of check your Blackness at the door if you want to be able to function in this space. And there's an added labor that comes to that, right? There's so much invisible labor in terms of being Black students, of how we maintain composure even when there's certain ridiculous things that are happening in classrooms, or how we maintain stability when we see our communities be attacked in textbooks, and just so many ways in which that weighs on us. And then not even to consider the own personal aspects that we may be experiencing outside of the university, and that obviously have an impact on our capacity to engage with the space. And so, in my position, we talk a lot about student success. And people love talking about student success, and for me, there's no student success if there's no conversations around the mental wellness of our students and their capacity to show up as their full selves to the classroom, and what the barriers are in order to actually allow for that to happen. And so so coming from my personal lived experience, and coming from the home that I was so blessed to be raised in, that's been really how my compass in the work that I do right now.
Perfect, thank you so much. Now lastly, we have Dr. Lashley.
Thank you very much. I started off life not in mental health, not in psychology. I started off life as an oceanographer and an opera singer. And I realized that I had reached these pinnacles. I could do all these things, but I was essentially alone. It was was an uphill battle. And but I left the armed services. I was in the Canadian Armed Services. But I left the armed services where I was an oceanographer. I went to school in Florida and I was back here. I realized that I needed to do something to bring about some changes, some things that I'd suffered in the United States that I'd never suffered growing up in Barbados, and things I had experienced in Canada that I had never experienced in Barbados. And so I redirected myself, and actually I went back to school, and I went back to school at Concordia before I went to McGill. And that's where I started. I had my daughter, and I realized some of the things she was being subjected to in school. And so I had to work out ways to make sure that this wonderful child was always being told that, and helping her to understand that she was important, regardless of any other messages that were coming to her. I mean, she was in a safe space in the home. She had family who loved her, but supported her. But of course, then she went back into the school space with people who really didn't understand anything about Black children, and she was pretty much the only Black child in her class at that point. And there were some issues that occurred with which she had to deal, and with which I had to deal subsequently and consequently. And so that got me on the journey. And I became, after I got my master's and PhD and so forth at McGill University, I opened the Employee Assistance Program at the Children's Hospital. I was the director there. And what occurred to me was that I was patching people up, but essentially sending them back into the same situation, especially when it pertained to Black people. I was patching everybody up, but with Black people, there was that extra layer of the environment, of the social conditions, of racism, of discriminatory practices, of structural and systemic racism. And so patching them back up, but not giving them the tools, or most importantly, not giving the institution the tools that they need to change their behavior. So I changed my practice. I don't do very much private practice anymore. And I focus on the institution. So now most of my trajectory is I work with McGill. I teach in McGill. I teach only physicians, because when you're going to see a physician, they need to understand about pain for Black people. They need to understand about skin and what that means. I work with the federal government and with most of the departments of the federal government doing training for that. So I've taken the pressure off me, in a way, working just with Black individuals and working with the institutions with which we all have to interact. My attitude is, if I can get some change there, I can get it to trickle down and trickle across the spectrum. So that's where I am and what I do. I'm a mental health advocate for the community, but within the halls of the institutions and the organizations and the 3 levels of government. I hope that answers your question.
It does. Thank you.
Thank you so much. We're pretty good on time here. So, let's start off with some open discussion questions. For our guests, please know that these questions are directed to nobody in particular, but they can be answered by all. So the first question here is, the pandemic is an added stressor on top of the daily discrimination and racism Black people face. How do you feel that this pandemic is further impacting their mental health?
If you don't mind me starting, there's one of the things. So actually, so I just applied for my PhD. So I'm gonna be a PhD student in the fall. And one of the thank you. There's some clapping hands happening. Thank you. Appreciate that. One of the aspects that I'm looking at is how, in terms of addressing institutional racism and where the Black home kind of fits in all of that. and how it's in so many ways kind of the root of the way that we theorize and kind of our practices come from there, and that's where we expand. And one of the elements that I was mentioning in my work was that it's been, for me personally, quite an interesting experience to, during this pandemic, continue to work and to be online and to have this computer essentially in our homes, right? In a Black home. And when Black communities are so surveilled, right? And so there's so much like our existence is not necessarily accepted in kind of society. And so all of a sudden you have this camera in your home, like almost 24/7, and how much we have to share with the world. And so I was reflecting on that in terms of my own work, and I've been thinking about how much that has also impacted our Black students. And so I think, you know, I can mostly speak about Black students, and I know that the pandemic has affected Black communities across the board. But one of the things that I see a lot with our students is how difficult it is for them to have to, on top of everything else that's going on top of the fact that, you know, each of them have their own personal cases of how this has affected their finances, how this has affected their capacity to be in the space, and et cetera. But they also, I feel like Black students in particular, have to navigate, how do you share your world in a world that doesn't accept you? And how much of an extra demand that is, right? So when we ask our Black students to turn on their microphones and turn on their cameras, when, you know, their home isn't something that is well respected, and they may not want to have to share with the community, and that they also are not necessarily being welcomed by welcoming eyes, right? So they're being judged in a lot of ways and misunderstood. And so how does that also impact the way in which they interact? And then also we've had another aspect of that is how much the traumas that they would experience normally in the physical space of the school, and then they are able to kind of leave the school, right, and go back home and see their community. Now these incidents are happening inside of their home. So we have had, you know, quite a few students who have, there's been incidents in classrooms of, you know, microaggressions, which is really racial violence, really, at the end of the day, right? So they're experiencing racial violence, not just in class, right? Because now the classroom is in their homes, right? And their families are hearing what they're hearing, what they would normally be hearing at school, and how that has a huge impact on them. And so, you know, I'm only talking about one sliver of how the pandemic has kind of added to that stressor, but I really, I've been thinking a lot about just what we have to mediate in terms of having to share so much as a community that is surveilled and not well respected in the world.
Thank you so much. That very, very well said. Did anyone else want to comment on the question or have any observations?
Yeah, I'd like to add to what was just said, because it's an extraordinarily important point, and one which I have been highlighting to federal ministers about. You know, we tell people, for example, not to put up virtual backgrounds. We want to, you know, we say, oh, the virtual background puts something between us. One of the things is that your home is your castle. Your home is your palace. Very often in the workplace, people aren't allowed or not encouraged to put up their cultural icons, the things that bring them a sense of place and a sense of safety. So the iconography that you put on your walls at home, including the pictures, your family's pictures or things from your home, which gives you a sense of place and a sense of comfort. That's something that when you leave the workplace that you go into, it's almost as though you're going to your own, for want of a better word, your own cocoon. It's a place, it's your culturally safe space. when you can't, and being able to put up a virtual background allows you to maintain that barrier of what is yours and what is the workplace. However, when people are forced into a position, either because the technology freezes, or within the workplace you're told, oh no, we want to be able to see your entire environment, it reduces that space. So you no longer have that safety. And so people are now in a situation where they say, do I have to take down my iconography so that when people look into my space, they see in my space as so-called normal, that it fits in? This, of course, then puts greater pressure on that person. It makes them feel that there is no safe space. There is no culturally safe space. It's no longer theirs. And so that's something that I've been talking to governments about, that we've got to stop telling people that they can't put up that virtual curtain, because that curtain very often is one of the things that helps people to maintain their mental health by securing a space that is particularly theirs. I hope that makes sense to you. I'm trying not to make it, what I say, too esoteric, but
No, that was fantastic. Thank you very much, Dr. Lashley. So does anyone have any other comments that they'd like to make onto the question?
I think I would like to add that, like, with the pandemic, we've seen there's so many different factors that play into mental health. Like, for one, we've lost a lot of cultural spaces. So like, in general, a lot of small moms and pops businesses have been shut down because they can't make rent, because of reduced business, because of the reduced flow of people coming into their businesses. And with that, a lot of culturally relevant, like restaurants, hangout spots, they're now closed for good. I'm from Toronto, so I'm going to mention things from Toronto. But there's this one spot that's been open for decades, in which, like, you get your doubles there, you get your jerk, you get your Caribbean food. There's people who play pool. There's like old classics reggae that gets played, and hundreds of people come throughout the week, every weekend, just to hang out and spend time. It's a regular bar. It's not like it's a club or anything, but this was a cultural hub, and it's since been shut down since we started the COVID-19 protocols last year. And so we're losing a lot of ways in which we can come together. And that's something that's huge for the Black community. You have people who aren't able to attend church, or they attend church via Zoom, which is a huge cultural hub in the Black community. You have people who can't go to their regular socializing, like things that they used to do to hang out with each other. You have people who can't even work out. So like, there's so many ways in which we had before that we used to use to support our mental health without really being conscious of it. And we've lost these spaces. And I think it really impacts the Black community. Also, just the fact that, like, a lot of people's work, if you're working in white collar work, your jobs have been transported online into Zoom. So you have a safe space to work from inside your home. Sometimes it depends, because if you're a student, you could be a child with abusive parents, or you could be in a stressful home environment, etc. There's so many things that play into that. But at least COVID-wise, you have like kind of a cushion. Whereas you have people who are still doing factory work, working in frontline positions, being PSWs, nurses, etc., who are still highly exposed to the virus, aren't being supported by the government, as we've seen with the Montreal Nord here, and the community organizations that have had to step in. So there's so many facets, like there's so many ways that we're unsupported right now. And I think it's taking a huge toll on the community.
Thank you so much, Aisha. That was very well said. Did anyone make did anyone have any other comments to add?
I just wanted to build on what Aisha was saying in terms of, you know, what does it mean for isolation, like of a community that was already isolated from so many systems, right? So when we lose our community spaces, we essentially lose everything because we're not part of hegemonic community, and we don't, you know, the libraries, the like national libraries are not our libraries, the national archives are not our archives, and all of these aspects. So we rely so much on our capacity to congregate as a community and to have our mom and pop spaces and to have you know, as Dr. Myrna was saying, our sense of place, right? Which often is our homes, it's our community centers that we build. It's the, you know, my mom used to do a monthly with the people that she grew up with in her village in Haiti, and they don't get to do that. And so all of these things are that we have to do the extra work of creating for ourselves because we're excluded from so many parts of society. And so then when that shuts down, what do we end up being able to hold on to? And you know, and I don't want to only be negative, because I think that that's also one of the things that is so amazing about the Black community, is that even in these pressure cooker situations, we always find a way to subvert. And I've seen so many phenomenal online communities kind of get together. I've seen communities reach out to our elders in ways that we haven't before, and really challenging that, right? But again, it's this extra work that we have to take on ourselves, because we're not allowed to participate in kind of what is available to all, right? We always have to create our own systems in the margins.
Definitely agree there. Thank you so much. So if no one has any other comments to add or anything, then I'll continue on.
I just want to add one thing, if I may.
Of course.
There's also the issue of data. One of the things in terms of COVID and the Black community is that we don't have enough data based on what's happening within the Black community. We all know that certain parts of the Black community has been ravaged by COVID. You know, people living in multi-generational homes, for example, where, you know, several people have got to go. If you look at the care homes, a lot of immigrants, Blacks, and others working in these immigrant camps. I'm not saying that Blacks are all immigrants. I'm making a distinction between immigrants and Black immigrants and so forth. Working in these care homes, we know that they're getting ill. We know quite a few of them have died, but we don't have the data. We need to collect the data so we can see what needs to be done to help these populations. And the government has been very reluctant to collect those data. I published a paper about 3 months ago talking about that. We've got to do it. It's important. And it comes back to are we fully part of the society or are we not? You can't just play lip service and say, we're all part of the society. But when it comes to the nitty-gritty, when it comes to doing the things which we need to bring about progress in the community, to really incorporate the needs of the community and the understanding of the community into societal policies, you can't just then say, I don't want to touch that. It's just like saying there is no systemic racism. We all know that's total nonsense, but that has become multiplied in this time of COVID. So I just want to say you know, what we call racism a wicked problem. And we call it a wicked problem because there are so many aspects to it that when you try to look at it only from one aspect and try to fix it that way, you will never succeed, because there are so many trajectories leading into the nucleus of racism. So that's something that for which we've all got to advocate. We've got to advocate for collection of data for all these other aspects that lead into racism and thus for mental health.
Yes, very, very much agreeing with you on that. Also, since this brings us up to our next question here, just our open question. It's in regards to the government of Quebec. So they've apparently invested 25 million in mental health services, you know, amid this pandemic. Do you find that this was a correct response to the ongoing issue, or is it just simply like a simple fix? Especially, you know, following Legault's comments on how Quebec apparently does not have a systemic racism issue. Oh, and the floor is open to all.
Well, from experience, I don't know if this will answer the question, but the aspect of denying systemic racism, I think we could all speak on that. I think we could all share like different type of experiences that we had throughout our parcours. I remember explaining to someone the aspect of racism, and it was a classroom setting, because Annick mentioned that sometimes, you know, in classrooms certain things are said, and as a Black individual you are often you know, like 3-4 direct minority in class, right? And you also they tend to point the finger at you to represent your whole ethnicity, your whole race. So there's a lot of pressure a lot of times when you decide to raise your hand and to speak out. But during a class session, I had to speak out because the person said, no, it's impossible. There's no such thing as racism. Like I don't see it. I don't really believe it. I think people are good. And I don't know if that person was coming from a good place, and I'm sure they were, but it was to explain, and the word that got me was, then the class started going and leaning towards the person, saying that they people weren't racist, people are different, people change, it's a new decade, people have evolved to the better. Then the classroom went and said, I think it's due to uncomfort. I think it's not racism, but I think people are just simply uncomfortable with each other. So I remember giving the example of describing the aspect of uncomfort. I took someone that I knew in class, a white individual, and I told him, how do you feel when you walk into a room full of Black people? Dude, how do you feel? How do you really feel? Obviously, the person lied at first, said, yeah, I would feel comfortable. I don't have no problem with it. Then I asked the question a second time with a serious face. And they said, well, of course, I'll feel slightly uncomfortable because there's no white people within that room. So I said, perfect. This is how we feel every single day. So when you think you're living a moment, we live it the minute that we are born. And they remind you constantly of your color. And that goes into a bigger talk than just being uncomfortable. So that was the way that I had to sort of like take their own words and present them the aspect of racism, and that it exists, and that we're constantly reminded that, hey, you are Black. I know. Hey, you are Black. Yes, I get it. I know. So it's a nonstop ongoing conversation. And I think people are often too uncomfortable to talk about it. Or when we talk about it, it's panels. And don't get me wrong, I'm loving this. It's panels of only those that are being victimized. So that was my 2 cents on it.
I would love to comment on that. Thank you, Karl. I think throwing money at a situation is never always the answer, right? It is, what are the people going to do in power with the money? Like what is the needs of the community, and what are the needs of the people, and how can we respond to those needs? As a community worker, that's what we're always constantly thinking. What does the community need? Asking the population, what do they need? What are we seeing, right? So just saying, hey, there's how many million, thank you for the money. Of course, we want the money, but it's also having the tools to make it work, right? who are even getting the money? Who are the people who are actually having access to the money? Is it the community? Is it our community that are actually getting the access to the money that we know that we could respond to the needs and to respond to these issues? How are we going to respond to, folks being isolated, right? How are we going to respond to folks still needing to work in a pandemic? You're afraid to go on the bus. You're afraid to use public transportation. There's so many fears. And as a director, we see it in our staff. We see it in our workers. They want to come to work, but there's this to get to work, right? And how are we going to support, right? How are we supporting our mental health? How are we supporting the little nitty gritties, right? And one thing I always find is that we always think something is good for somebody, but do we actually know, right? So it's really finding, like Dr. Miranda was talking about, the data. What is actually happening on the front line? What do people need? They need insurance. They need access to proper health care. They need access to mental health resources. They need access to accompaniment. Like, how nervous is it to, your first time maybe not seeing a psychiatrist or seeing a psychologist or seeing a therapist? How can we create support systems so that people feel more comfortable, going to these services and accessing these services? So I think it's not enough to just throw money. It's action, systemic reform. Then we can move on, right? And then we could start implementing these things, right? To the people who know the community, to the people who know the experience, right? And creating those allies and having those allies, you know what I mean? All of us push forward together.
I think one of the problems is that these things tend to take on a surface quality about them. So the government says, I've listened to you. Mental health is a problem. We're going to put these $25 million into mental health. And Nadine and Karl, you're absolutely correct. What does that mean? If you are going to solve, there's a wonderful line in a Rocky Horror Picture Show where he says, we're not attacking the symptom. And that's really it, is that if you're going to put this money in, you have to know what you mean by mental health. What are the variables that lead into mental health? Now, we're moving more and more towards something called the global mental health movement, which is going to be a total mess for a lot of the cultural communities, because the perspective that people are bringing to this is that there's a single trajectory, and schizophrenia means this and bipolar means this. And that is not going to work, because we know that the idioms of distress among different cultural communities are manifested differently. And we know that different things play into it. Now, what the government has done, if they put the money there, but they haven't made sure that what needs addressed is being addressed, because they're still looking at it almost, they're already ahead into this global mental health thing. They thinks that a pain over here is the same as a pain over there. And I give you, as I said, I teach medical students and I teach doctors. You take something like, I don't know if most of you know what Mongolian spots are. When Black babies are born, very often, some of them develop Mongolian spots. They disappear within weeks, within months. It's no big deal. It looks like little bits of pigment, but it's not. It looks like, if you don't know, you'll think that somebody's been bruised. So the child is brought into the emergency room, and the doctor, the resident, is looking at the child, and the resident signals social services, says to social services, this child is being abused. So the social worker came into the emergency room, looks at these things. A white social worker knows nothing about Black babies and the black skin, but she sees these dots. So the file is open. The police are called. because this mother has apparently abused her kid. It took somebody who knew, who happened to be there in that room, who knew about Black pigment, and said, for God's sake. And it was a white person who knew it, who had taken the time to learn more about other cultures rather than just his culture, who looked at it and said, for God's sake, what have you done? These are Mongolian spots. They will disappear. Nobody's being abused here. Of course, what's happened is that you've traumatized the mother, you've traumatized the family, and now she doesn't trust the system anymore. So when something happens to the child that we really need to see that child is not brought to the emergency room because the mother is now afraid that she will be traumatized again and accuse them. Imagine what this has done to the trust that should develop between caregivers and families, the trust that should develop between us as human beings. And it's all because we have stuck within our Western and Northern European way of looking at the world. And that's something that we've all got to challenge. Otherwise, kids with something as simple as Mongolian spots, that family becomes traumatized. Then we get into intergenerational trauma, and the mental health problems, the mental illness problems start right there, and the trust deteriorates. I mean, it's a rolling situation. So yes, they gave the money, but for what is this money? And how do we treat, and whom are you treating, and what are you treated? That's the issue. If we don't look at the social environment, we're just going to keep replicating and duplicating the same thing over and over again.
All right, so we're going to move on with the directed questions, unfortunately for the speakers that wanted to add on to everything, just because of time purposes. So the first question that I'm going to ask is going to be directed to Myrlie, Nadine, and Dr. Lashley. So although universal healthcare is available to all Canadians, this does not guarantee an equal understanding of illness, distress, or treatment. Can you speak about some of the inequities racialized groups face in our healthcare system? What do you feel should be addressed within the medical community to reduce these issues?
Okay, so I can give a start because it kind of echoes a little bit about what Dr. Mirna was saying earlier about disparities in our healthcare system, and what you had asked us, Brianna, about mental health and funding. I think that we really do need to ask ourselves, when it comes to the healthcare system, how are we working towards creating more opportunities for people of color to be integrated into the system, not just in terms of patients, but also making sure that there is funding for there to be more people of color being introduced into these systems, and to also ensure that if you're going to fund mental health and give 25 million towards mental health, who is at the forefront of the project? Who are the researchers? Who are the people doing the work? Are they people that look like us? Are they people that, so really kind of growing the system. And just to echo what Dr. Mirna was saying as well, I think many Black people have experienced disparities or inequalities due to misdiagnoses, due to lack of cultural competence. For example, psychiatrists often misdiagnose Black men as having schizophrenia because they think that when Black folks come in with worries or concerns about discrimination, microaggression, not obtaining certain opportunities that that they either witness themselves or that they've seen someone witness, they don't get the treatment that they deserve. They are under-recognized, they are under-acknowledged, they are seen as maybe having some sort of ideas that are grandiose, even though these are real experiences. And I think this happens when they're met with a white clinician who may be unaware of their privilege, that has yet to really learn about the challenges that BIPOC communities face, that are rarely exposed to Black clients or patients, or that hold racist or biased and discriminatory assumptions themselves, and that, as Dr. Mirna said, get infiltrated into what they learn about frontline care and what to do. So they pair their thought with, okay, social services, and then you have a whole commodity that could have been avoided. And so I think Black people themselves say, what's the point? Because they're not receiving validation, and they've learned that mental health services are very Eurocentric and Western dominated. which is also due to lack of representation, again, of our people in the field, in the healthcare and mental health care field. So when you go and you feel that your clinician won't understand you or your psychiatrist won't understand you, or where the most of the people that you notice in the system won't understand you. So fortunately, we do have more BIPOC professionals in the field and more non-BIPOC professionals that are willing to re-educate themselves and learn how to be anti-racist and work from an anti-oppressive lens. So I hope that that does cause a shift in the service quality that Black people experience. And I do think that one way, again, to change the political system is that we become a part of it so we can infiltrate it from within and make changes from within. And so we need to see more equal numbers of Black and other racialized people in every field, including the healthcare field, so that we can accomplish what we talk about right now in these spaces, seeing the changes that we want to see. And we need to provide more training programs to non-Black medical professionals about anti-racism and anti-oppressive practices, and talk to them about the types of issues that Black people experience, so they're more equipped to support the Black patients they see, rather than writing them off as paranoid or telling them that some symptoms they experience are normal or that they don't see an issue. Because when that happens, you just feel more and more invisible, and we reinforce the stigma, and we reinforce the lack of representation from the patient perspective and the worker's perspective.
Thank you so much. I completely agree with what you just said. Dr. Lashley, Nadine, if you guys have anything to add on that point.
I would like to, the thing is, we need to know the history. So one of the things that the healthcare system needs to know is the history of the atrocities, the experimentation of Black folks. There's a lot of Black folks who are scared. They are scared to go to the doctor. They are scared to go see somebody, because we need to feel and we need to be validated and heard. And sometimes we're not heard, right? We're always talking about, I can go in, for example, I'm a caregiver. I go in with my father and they'll come up with something and it's like, no, this is not right. This is not what's happening, right? Our pain, there's the stigma about, Black folks are able to withstand pain more. No, do you know what I mean? We all have our different types of pain. We all have, that little scale of 1 to 10 to really validate ourselves and listen to the patient, listen to the workers. The workers know what's happening on the ground. We know what's happening on the ground. So listen to us. And knowing that, again, the access to healthcare, the access to insurance, the access to all of these things breaks down the system. We know the system is broken. So we have to start from what is happening in the system, fix the system, right? So we don't keep on repeating the same mistakes, the same inequities all over again to different folks, right? It's really listening and taking action.
Thank you so much for that. So
I think one of the things that we try to teach, I'm in the transcultural psychiatry department, and these are exactly the things that we work on teaching, or non-Black physicians and students and so forth, and the Black ones too, because your color is not a verification of what you know. Because every one of us has been trained in the Eurocentric way of doing things, every one of us. And we as Black people, as people of other cultures, and I keep saying that because it's not just happening to Black people, even though we're talking about Black people here, have been not left out. We've been trained in the Eurocentric norm, and so we've got to break ourselves away from that also, and incorporate the other things that we know. We've got to do some of that teaching. Some of us are afraid, for example, we're ashamed to say, this is not what, when you call me bipolar, you put down that diagnosis, this is not what it means. And so now in the cultural interview, we ask people, what does this mean in your community? What does this mean? This is what we call it here, but it doesn't matter what I call it here. It's what does it mean to you? Because otherwise, whatever I put in place to help you, it's not going to be relevant if you can't buy into it. So not only do we have to train non-whites, we have to train, not only do we have to train non-blacks, we have to train non-whites also to be proud of their heritage, to know what they know, what grandma's taught them, what great-grandma has taught them. There's a lot of knowledge out there, and we are the holders of knowledge. And sometimes what you know, what you believe is very instrumental in helping us to help you to get well. But if we keep forcing things on you that aren't relevant to your way of seeing the world, it can be very, very difficult, because you're going to fight back. And why shouldn't you? Why shouldn't you? But we've got to realize that we've also been taught in that Eurocentric model. And I mean, you know, if a lot of you have studied the humanities, you look at Kant and places like that, people like that, they keep shoving down our throats. Kant was one of the biggest racists going. You look at psychiatry, Cartwright, well-known psychiatrist, Cartwright said that slaves trying to escape enslavement, that he gave this a psychiatric diagnosis. And so the act of trying to escape enslavement was seen as a mental illness for Black people. Why would you try to escape working for your superiors? That's the way. And of course, it got incorporated into psychiatry. So we've all been taught this. And so we've got to learn our own history. We've got to learn what has impinged upon us to get us, as Fanon states, to stay below this line and incorporate inferiority into our lives, while those above the line have been taught to incorporate its superiority into theirs. We've got to, as I said, it's a wicked problem. We've got to challenge it on many, many different angles.
And I know that this was supposed to be a directed question, but I wanted to build on what Dr. Myrna was saying, because it's so important. This aspect of respectability within our own community is, we need to challenge that, and we need to believe each other and hear each other and learn from each other, learn from our own history, unpack the internalized racism that we have kept inside of us, and that is, you know, and continues to grow if we don't address it, right? I wanted to say something because, so there's this stigma around also kind of this respectability within our Black community of whether if you're educated, if you were more this, if you were more that these experiences wouldn't happen to you, but it's not true, right? I experienced Black maternal violence. I was left in pain for 56 hours before they treated me, right? And I'm a highly educated Black woman who knows about this violence happening in our communities, and I still experience the same thing. What Dr. Myrna was mentioning about Mongolian spots, right? My child has Mongolian spots, and the nurse that was delivered my child and was there specifically told me, she came to see me afterwards, a Black nurse came to tell me, I put it on the file, all the places that he has these spots, just in case one day down the line, something happens to you, you can tell them that the Jewish General records has it on file that he has Mongolian spots from the birth. So this is, you know, we're doing this work, preventative work, because we know it's true and it happens to absolutely anyone within our community. And so this idea that it's, if we were more educated, if we advocated for ourselves more, if we is completely false, right? And so how do we then address the systemic aspect of it that is blind to none of that, right? Like could not care less where we come from, and is really it really is systemic racism. And kind of back to the question around, you know, is the money enough? It isn't, because if in the same breath of giving the money, you are also saying systemic racism doesn't exist, then that means that you are saying we will not take any responsibility for the way in which this has impacted your community, right? Our community has immense rates of dementia. Our community has immense rates of mental illness, et cetera. How much of that comes from racism? We don't even know, because no one even wants to do that research. and understand why our communities have specific illnesses that are very specific to our community, and also the experiences that we've had to endure that led us into these circumstances, right? So all of that is so linked, and if we assume that just because we are Black, we are aware of all that, then we have a missed opportunity of really understanding what it is to be anti-racist and to do the work of actually dismantling the system that we were raised in.
Thank you so much for that. We're going to move on to the next question. It's for Black Mental Health Connections Montreal, so Aisha or Kristen, Miranda, and Annick. So why do you find people within the Black community are afraid to seek help when it comes to their mental health? And what first steps should be taken to break that stigma?
Well, I can say the common ones I see, well, it's generational too, that older members of the community, West Indian especially, the answer to, generally speaking, prayer is the answer to God. Need seeing, I see that a lot in my work. To steal Nadine's line is,
Miranda,
can't
sorry
hear,
to cut you off. You keep cutting. So
I know my
try
state,
closing
I'm not
off your camera.
stable. Okay, all right.
Try closing off your camera.
Okay, that's what I was doing before. Okay, thanks, Karl. Sorry. Yeah, so as Nadine says, so when we do workshops together, you know, God, prayer is good, but God made therapists too. So we're trying to work it from that angle. And then I also see it as people view it as a sign of weakness. So to ask for help, to ask for mental health help is a sign of weakness instead of being seen as a sign of strength. So I think that's an area we should be changing culturally overall. And it's a sign of weakness, I think, too, for some people I've spoken to will mention, you know, we deal with so much adversity during the day. How can I not handle this or some, you know, something to that effect. So I think we need to promote more that it's actually a sign of strength to get help. And also the fact that we don't have people that would understand us, what Annick and others have said here. I think what Black Mental Health has done, Connections has done great, is there's a compilation of Black therapists, Black counselors. I know from my younger days working as a bartender and when I was a student, and racist comments would be made at the bar, and I would try to stand up you know, and I'd be told I have no sense of humor. I was working in a comedy club, of course I have a sense of humor, but you know, they were like, oh, you don't have a sense of humor because you don't find, you're too serious. You take words out of context. You play with words. You know, it was always this. So you stop trying to change the narrative of the situation because it's just passed off as you're angry, you're this and you're that, right? So I think we see that when we would go to a therapist who's not empathetic to our background or have understanding, how are they going to help us? They live in a different world. So having more people that we can see who are from our world and understand what we're going through is definitely a key, starting step anyway.
Definitely. Does anybody want to add on to that point?
Yes, I'd like to add on to what Miranda said. For one, just like difficulty in marginalized communities being comfortable with being vulnerable. For one, I think this comes from a lot of different angles. So when you look at the African diaspora, you have people who are descended from people who were kidnapped, enslaved, and tortured. And so oftentimes they had to hide their suffering, for one, to save face for people within their own communities, to keep up that resilience that kept them going on throughout that torturous time. Then you had people like, it's kind of been this colonized way of thinking has been perpetuated. So then you'll see oftentimes within even your own families, you're told, oh, why are you crying? You shouldn't be crying about that. Why are you sad? You didn't have to deal with immigration to come here. You didn't have to deal so there's that invalidation that comes from within the community that is perpetuated from, I think, colonialism, and also just like a prideful culture, And often the world doesn't even look at Black people as like emotionally complex beings, people who can have all these different experiences. So the world invalidates our experiences, and they're like, you don't have sadness. Like if you could even just look at the news when, or even just look at interactions of police with mentally ill Black people. It's like oftentimes that ends in death or it ends in incarceration. And it's just like oftentimes someone's just having a crisis. Sometimes people are just having a bad day. A white man can go into a massage parlor in Atlanta and shoot 8 people because he's having a bad day. But if you're chronically poor, are a victim of different traumas, etc., and you're having a bad day, you get shot down by the police here. And so there's a lot of reasons where, for one, I think we internalize this invalidation of our own feelings, for one, culturally and individually. And then it's just like, yes, to add on to what Miranda is saying, like culturally relevant resources. For me personally, I've started my journey since I was 19, when it was even brought to me that I could be dealing with things like depression. Like that had never been a concept that came to my mind. So I sought out different tools, like as someone who didn't have that much money, government resources, like oftentimes you'll see a different counselor every day. They don't really care about your story because they don't know you. Or like when you go to resources where it's like geared to income, sliding scale, sometimes these are people who aren't like you. They don't look like you. You don't have anything in common. Like for me, actually, I started doing therapy recently, and I've only gone back now because I was actually able to find a therapist who has things in common with me. We're from like similar areas in Toronto. We're both Black cis women and of Caribbean descent. And it's like the only way I could find that is going through like a resource hub that puts all of these therapists online, so that I'm able to have online therapy with this person. But before COVID, I've seen probably 4 or 5 people, and I've done 2, 3, 4 sessions, and like each time it's like, oh, actually, I don't feel comfortable sharing with you. I don't feel like you understand, and also it's this barrier of me having to explain the complexities of any of the issues that I'm talking about. It's just additional labor for most of the hour. It's me explaining the relevance of what I'm experiencing versus getting coaching on how to manage these experiences. So there's a lot of things that go in that, and also just distrust of the state's infrastructure and support systems already, because there's a number of government and led projects for the community, but these are band-aid solutions that often kind of leave people in a limbo, where it's like, if you take this program, you'll get help temporarily for 2 to 3 months, but then you're back stuck where you started. Especially if you're someone who's on government assistance and things like that. Like oftentimes, a lot of these programs will only help you if like you stay on like if you get a job, then it's like you lose your assistance, and it's like this whole period where you're not supported, you don't have funds. So it's like there's a lot of complexities that go into it. But just having these conversations and just talking about it in terms that are like relevant. Like when we talk about mental health, oftentimes people look at like diagnoses like borderline personality disorder. It sounds terrifying, but it's actually a pretty common diagnosis for people especially who've experienced trauma, which is very common within marginalized communities. So it's like talking about things in ways that like normalize these experiences and let people know that it's not as like terrible or negative as we've been taught to think of them.
Thank you so much for that. Yes, Annick.
Yeah, I appreciate so much of everything you say. I would echo all that, and also add that, you know, the malpractice that we saw in the past is still active, right? Like there are many situations in which patients are revealing to doctors and that information is being shared with other systems because it seems like it's a threat because it's coming from a Black person, right? And when people are going to see psychologists, psychotherapists, and then they end up losing their children because of it, they end up in prison because of it. These are things that are actually still happening, and so there's a lack of trust because of our long history, for sure, but there's also a lack of trust because we have these tangible examples in this current moment of ways in which our community are not safe to be able to share. When like growing up, so much of what would happen in our homes, we're kind of taught to don't talk your business, and there's a reason, right, why our parents were teaching us that's right. Like there's also an understanding of what happens when, as a Black person, you share your experiences and how it's misinterpreted, used against you, and then you are actually not served well. We think one of the examples that comes to mind is the ways in which there's a sexual assault resource center that's beginning in Montreal North, and thinking about other structures of policing, other structures of community accountability, and et cetera. And the reason that we need to have that is because, a Black family experiencing sexual violence will maybe not want to call the police, and there's a reason why we wouldn't want to call the police, right? Like what ends up happening when a police intervenes in a Black home, right? Versus still needing to address the issues, still needing to have community accountability, still needing to be safe, but also knowing that this is actually not a pathway to safety for us. And I think that one of the things that I'm happy to be seeing in our community is that there is a redefinition of what mental health actually means for our community, but also what mental health practitioners look like for our community. Dr. Myrna was talking about this before, right? Thinking about our grandparents, et cetera. We've had ways to care for one another for many, many generations. Mental health is not an invention from this generation, right? It's something that we've been working on for many for many lines of generations. So how do we go back to those practices? How do we get some of that understanding of how to treat one another, to be able to support one another? Do we all need a psychologist, or do we all need a psychiatrist, or do we need a wealth of practitioners that are different and might be culturally specific, and whether that be in terms of identity or in terms of place, and all of these different mechanisms, and being able to have these conversations, I think, are so key to encourage one another to innovate in that way. But then we also need to start thinking about how does that get recognized, right? So for example, I have an acupuncturist, and I think about how much the Asian community has worked towards making sure that traditional Chinese medicine, acupuncture, et cetera, all of these things are well recognized in the North American world. And now my insurance pays for acupuncture. So if we were to have an equivalent service from the Black community, what kind of parkour would it take for us to be recognized as practitioners as well, right? In order for us to be able to support one another in a way that's not kind of digging from our own pockets and all of that. And so I don't think that the issue is just that our community doesn't want to go to Black mental health practitioners, but also how is that facilitated by the wealth of practitioners, but also the systems that will allow them to be able to tap into that.
Perfect. Thank you guys so much for this section.
I'd like to mention too, not to digress from mental health, but I'm having this issue with vaccines. Many, especially Indigenous, they will not go for this at this point. So this is a whole, and that's a life and death situation potentially, right? So it just shows.
I had a quick question. The panel that is tuning in, it's diverse background. It's like all types of people, or is it a panel of Black people that is tuning in right now? When I see the 49 people.
You mean the audience, right?
Yeah, the audience itself. Yeah.
Yes, so the audience is constructed of a multitude of people. They were able to sign up through the Facebook event page. So we have all types of people here right now.
So because we have all type of people, I'm loving this panel right now because it's a lot. It's not only the Black experience on different levels, but also it's a panel full of Black women. And I'm loving this because I not only get to hear your stories,
Of course you are.
but it's also your perspective. I need to say one thing though, because Gabriel's camera is off and he's the one doing this. As a Black man, we're slightly raised different, and you guys know what I'm talking about. You guys spoke about the aspect of mental health. I remember when I was a kid, accessing emotions wasn't part of my repertoire. Like I wasn't allowed to be soft. I wasn't allowed to cry. I wasn't allowed to say that I'm sad. So it left place to one thing, and it's a lot of anger. I was angry because I didn't know what else to feel because I was denied that feeling. And the pressure that I was put on didn't come from a negative place. My mom raised me to be tough because she said I had to be tough because the world is going to treat you differently. The world will love you when you entertain them, but the world will hate you when you disrupt that entertainment, when you show emotion, and it's true 100% because I lived it at every age. I lived it I remember elementary school, and I'm sharing this because it's like you guys said, it's a diverse audience. I remember in elementary school having a crush on a white blonde blue eyes little girl, and that little girl calling me, oh, I can't like you because you're the color of caca. And I was like, what? And at 7 years old, I left Haiti to go to the States, and then I came here. I lived in Haiti, so for me, all I saw was Black. I went to the States. I lived in Brooklyn. I was young. All I saw was Black, and then I go to the school. I see diversity and thinking that people were all the same, because I was always treated equally, right? So having that first experience being recognized, being dissed because of my color of my skin, I had to go back home. And that's when I had the explanation of, you are a Black man. You will not have space to live certain type of emotions that regular kids get to live. And the reason why I wanted to highlight the panel full of women is because it has to be, as difficult as it is to be a Black man, it has to be 10 times more difficult to be a Black woman, because you guys have to raise these Black men. So I give chapeau to all the Black women in this panel, because holy smoke, whatever I lived through, I can't imagine what you guys went through throughout life. So I think it was important. It was an important aspect to highlight, again, because of the diversity of the audience.
If I may, I'd like to add to that. Premièrement, j'aimerais dire merci beaucoup. Because that's really, really, really important. What you brought up about being in this Black environment in Haiti and being in this Black environment in Brooklyn, and then going to school and having the reality thrust upon you. This is such an important aspect of mental health as it pertains to the transmission of intergenerational trauma. Imagine you're a young boy. You're a young boy. You live in Brooklyn. Maybe you might have a little white friend. I know that there weren't a lot of white kids in Brooklyn, but let's say you have a white friend. So you go to school and you think, oh, I'm the same as everyone else. I'm the same as everyone else. And then a little girl innocently says to you, oh no, I can't like you. You're the color of cacao. Or your mother has to say to you, you know, your friend John, your life is not going to be the same as your white friend John. But you and John have been buddies. I mean, you've been best mates. He called you brother. You called him brother. And now, from the moment your mother has to break that painful truth to you, and believe me, it hurts her to have to do it, you now go back to school and you see John differently. He's still your buddy. You might still think of him as your brother, but you know that life has dealt you different cards. You know that John can walk down the street. The police are not going to stop him if he jumps up in the air and hits the signpost, if he does a hoop jump. You know, if you do it, you're going to be stopped for attacking public property. You know that life is now different. And that's a trauma. Your mother has to relive that trauma because she brings up stuff from her own childhood, from her own history, to help you to understand. So she's reliving the trauma, but she's also traumatizing you in order to help you to survive. So she's telling you, listen, you know, I can't allow you to feel that pain and to cry because it takes away from your strength. But she knows she's traumatizing you and she doesn't want to. But her big thing is, how do I protect my son? How do I raise the odds? And when my kid goes out for that candy bar at 8 o'clock at night, that he comes back home in one piece. And so Black women are always having to weigh this. And it's painful as all get up. They're constantly re-traumatizing themselves in order to protect their offspring. And so thank you for that recognition, for your mother and for all the women who have helped you be the young man that you are today. And thank you for recognizing the women here who are doing that and recognizing that they have to hurt their kids to save their kids. I mean, that's a horrible situation for a person to be in. That's a horrible situation. Of course, it's going to give you mental health difficulties because every time your kid leaves that home and every time that kid goes into a store and buys a pack of gum, that child has to remember, and you have to remind that child, do not leave that store without that receipt. Because the last thing you need is somebody to put their hand on your child's shoulder and call the police and say, he stole a pack of gum. You don't have the receipt. They're not going to give you the benefit of the doubt. You don't have to prove. You need somebody to vouch for you. So thank you for recognizing the women in your life. Thank you. And that's all I want to say.
And if I could just also add to that, thank you so much for highlighting some of the differences between Black mental health for Black women and Black mental health for Black men, right? When we look at and think about different practitioners, different types of spaces for mental wellness, it won't look the same for our Black men. They're not traumatized in the same ways. They don't communicate in the same ways. The need for Black male leaders in our communities across the board is so key. And I want to just take a moment to appreciate your presence here, Karl, and how important that is for us. And also just how in knowing that there is a difference there, then how do we serve that? How do we create spaces? There was, I remember there was a point where Desta was doing like a circle for Black men. I can't remember what they had called it, but it was like a group of Black men that used, and honestly, I would just hang out outside, just knowing that they were doing that together would bring me so much joy and so much healing, even though I was not in the space, right? Because I know how necessary that space is. And as a mother of a young Black boy, I want them to have that space, and that, your healing is our healing at the same time.
Perfect. Thank you so much. Honestly, all of these responses, Thank you so much. We all really, really appreciate this here. So we're going to go a little bit, forward, and we're actually going to be participating in the workshop, talking about the workshop tips. So essentially, we're going to be, starting with tips on, dealing with microaggressions, or any other acts of racism. Would anyone have any tips in regards to that?
If I may. First thing I tell people is stop being your own worst enemy. We have internalized so much inferiority. We have internalized so much pain that we're not always sure how to get out. We've made a friend in a lot of instances. We've made a friend of the pain that's been inflicted on us, and we keep inflicting it on ourselves and inflicting it on our children. Amilcar Cabral said, we've got to stop shooting the bandit's shadow and shoot the bandit. In other words, we've got to put the target where it belongs, which is on the institution. It's on whiteness, not on white people, not on white people, but on whiteness. Whiteness is something that comes out of colonialism, and it's destroying white people as well as it's destroying everybody else. So we've got to start being our own best family, our own best friend. If we need help, seek help. The very people that are looking down their noses at you and say, oh, you're engaging in cultural betrayal, for example. If you're being beaten up and you don't call the police or turn that person in, and they say, oh, you're engaging in cultural betrayal. When you get killed, they're going to say, why didn't you call the police? Why didn't you reach out for help? You don't owe anybody your life. Forget about that. Be your own best friend. Make sure that you have a support system around you. Who's there to cradle you? We tend to give all our help to others. We tend to be the ones caring for everybody else. And we forget that we're not endless pits of caring. It's okay to set up parameters and say, no, enough, I'm not doing this. It's okay to say, I'm going to step back. I need some, even from our kids, it's okay to say to your kid, you know what, mommy needs 10 minutes. And that 10 minutes, I'm going to sit in the bathtub and don't you bother me. There's your milk, there's your cookies, go do whatever it is you're going to do. I'm reading my book. Make sure that you keep your word, though, that 10 minutes means 10 minutes. And if you have to advance it, say to the kid, mommy still needs 5 more. Can we negotiate 5? But so that your child knows they can trust you. But the most important thing is to be your own best friend and do everything that you need. What you would like a best friend to do for you, like give you that massage and read you that story or give you a break, do that for yourself. I implore you, do that for yourself. Shoot the bandit. Stop shooting the bandit, Shadow. Otherwise, you got to come and pay me a whole bunch of money.
Thank you, Berna. Just to add on that, though.
And I'm not cheap. I don't do $65 an hour.
I think that my wellness tip for everyone would be to find a community of people, to build on being your own best friend. Yes, be your own best friend, but also acknowledge that sometimes you can't be your own best friend and you need someone else to be that best friend for you. You need someone else to say, hey, you're not doing so great. I haven't seen you in a while. I haven't spoken to you in a while. Do you need to check in? And I think that comes from building this community of people, building this atmosphere around you, the same community spaces that we're missing from those mom and pop places, from the community centers, building that in an electronic forum, like I think Annick spoke about earlier, so that you not only have yourself to rely on, but there are a group of people who will check in with you to make sure that you are upholding your boundaries, to make sure that you're finding joy, to make sure that you're taking the time to recharge and to rest yourself. I think that like personally for me, that's been how I've gotten through this pandemic, is creating those community spaces that I can no longer go to in an electronic way, so that the same people who would have supported me in person, I could just like pop by their store or pop by their house. I now like pick up the phone and I call them. I'm like, do you have 5 minutes to FaceTime me? I need to take a break. And that also prompts me to do some physical things. Like if I'm going to be on the phone with someone to check in with them, I make sure I'm not in front of my computer. I'll go for a walk around the block while I'm on the phone, so that that community time is also a time for me to check in with my body. Have I had a sip of water today? Have I eaten any food? So I'm going to call my friend, and when I call my friend, I'm closing this laptop, I'm going to go grab an apple, I'm going to go walk around the block to take this phone call. And I don't think that that would happen if I didn't have this community that, sorry, Karl, they are all women, but this community of Black women who I can lean on and who I know will hold me when I can't hold myself.
Just wanted, for a point of clarification, when I talk about be your own best friend, that's the kind of thing I'm talking about. I'm not talking about being in isolation.
Oh, no,
I'm
yeah.
talking about the things you're talking about. That's being your own best friend. Making sure you've got that support system and doing all those things. That's all encompassing it, just a point of clarification.
Yeah, I want to definitely agree with all those things. I think also, you know, really looking at and observing Black joy. I think it's so important that we see us being happy and us, you know, doing good things and having good moments and having joyful experiencing and like reveling in the amazingness that we are, right? Really taking the moment to validate our experiences and, you know, looking around, and sometimes it's just, woo, you go, you know what I mean? Like doing that encouragement even to folks you don't know. Like in our community, we're so used to, you know, if I'm in Jamaica, everybody's saying hi to everybody else. Like, no, you don't know them, but everybody is saying, hey, what's up? You know, we don't do that enough. We don't do that and engage in that community enough with people that we don't know. And sometimes it's so simple to say, hey, wow, I really love this outfit, or I really like your eye smile with the mask, right? Right now, and really taking that time to log off. I think it's so important. You know, one of the things that I've found that was so impactful is that when we're seeing all these injustices and we're seeing all this stuff, we still want to go to work, and we still have to go to work and put on our screen. Do you know what I mean? I think it's also working for folks and being in a community and a work community that understands you and has an ability to have empathy and compassion. You know, there's so many people right now who's experiencing burnout, you know, anxiety disorders, really, you know, having a voice and making sure your voice is heard and explaining, even if you have to explain why it's important. So there was an experience when I was online and they Zoom bombed, and there was all the N words and talking about George Floyd and all this stuff. And I literally called, you know, my employer and said, I need 3 hours. I am traumatized. I am hurting. I need 3 hours. I will not be answering any calls. I will not cancel my meetings. I need these 3 hours to compose myself and to really take care of myself. And I have to, you know, reiterate that, because we also are going through that. We've never had to deal with that before, right? We've never had to deal with Zoom bombing and all this stuff happening. So I think, you know, taking that time to say, this is what I need. Put yourself on the to-do list. Put yourself as priority. You are priority. We cannot keep giving from an empty cup, as they say, right? We have to give with our fullness of self and knowing that our boundaries are there and knowing that we may lose friends too. You know what I mean? We may lose friends by imposing our boundaries. We may, you know, lose friends or be in situations when we're acting and having our voice and really making sure we're assertive in what we need, but it's worth it. You are worth it. Our self-care is worth it. Our community care is worth it. And supporting each other, really supporting each other, even if you don't know somebody. You know what I mean? Really just being like, I got you. You know what I mean? I'm gonna hold space for you, creating safer spaces. I think it's so important.
I would add to that, and I love what everyone was mentioning so far. So myself, in my lowest points, I'm actually not able to do any of those things because it takes a lot of energy for me to reach out. I don't have a mechanism I tend to really internalize when things are not good. And so one of my, the ways I've kind of addressed that for myself has been journaling. And not just on because sometimes I can't write. Sometimes it's too much, like your hand can't keep up with what's going on. And so I do a lot of different forms of journaling. So if I can write, I write. If I can not do that, I'll audio, like I'll do a voice note. I'll put the camera on and I'll film myself. And like in retrospect, in the moment, I didn't even really know why I was doing it. But in retrospect, I think that I do it because I need to believe that what I'm saying is true and real and have it believed by someone. And sometimes that someone is a page, sometimes that someone is my phone, right? Before I have the baseline strength to then reach out and do all of the things that everyone else was mentioning, because I think it's so important for us to have spaces to unload, because it takes work, right? It takes work to connect to one another and to try to share your brain and share your emotions and et cetera. And if you don't unload somewhere, sometimes there's not enough space to do that. And my mechanism has been journaling of some form.
What I tell my clientele is to zone out using music. Music for me during this whole COVID thing, it's been like a savior in so many ways. But also I work with a lot of Black kids that are, majority of them, hip hop heads. And I always encourage them to go outside the box. Well, I'm Black, I listen to hip hop, that's it. No, trust me, there's other music out there than hip hop. Hip hop is amazing. The culture itself, I love it. But I promise you, when you feel sad, when you feel, alone, the type of music that could address certain emotions that you need to feel. So I encourage a lot of my youth to branch out. And sometimes, I will make them listen to a song by like Gary Clark Jr. He's like a country Black man, but he's amazing. Bring it back to like some Marvin Gaye or whatever type of branch music, some old rock bands too. In my teen years that I used to bump. And Annick, you could come to that. I think Face was able to give me that diversity of range within music spectrum, right? And I appreciate that. And that's the thing that I like to share with people when things are not all good. And like Annick was stating, that you don't have the energy to move around, to do specific things. Branch out, try something different in your music setting. Now, the majority of people have Spotify or YouTube. Like try some Afro beats. Nadine was talking about joy, like seeing Black people happy. Have you seen those Afrobeat videos? Like Black people are happy, all right. So like it's for me, it's like music is key, man. Music is life. And I think, and I tell my youth and even the young adults and even the DYP families that I'm working with, don't box yourself into one type of genre of music. Like explore. There's so many things out there that that will give you joy. So for me, it's music.
Yeah, I think that's very important, is to find something that takes your mind out of its immediate state. So whether that's playing music that could shift your mood, or even like an activity, sometimes it's a show you'll watch, or like also I think there's two things I wanted to touch on is like with mental health, sometimes we don't realize how physical it is and just how much it builds in our body. Like if we don't move around enough, our brain isn't actually getting enough nutrients. We're not expelling as much toxins out of our mind. So that's one way it's like, okay, we have lower energy that way. We're more prone to low moods and like an inability of our just our mind, it physically being able to like function properly and healthily. Or like whether we're eating the right foods, if you're consistently eating junk food and not whole foods, processed, high sugar, high fats, and it's not having there's actually like a set of nutrients that your mind needs to function at an optimal level. And it's like a lot of us we're not getting those nutrients. And it's like even that, those are ways that our mind then we start slipping into depression. We have memory loss, we have low energy, we're more prone to frustration or like volatile moods and things like that. So like just looking at your health like holistically, like am I putting things in my body that make me feel like good, positive? Like even just eating fruits sometimes can make me feel a little bit better. Or like going for a walk and seeing the sun. Like after 6 months of brutal winter in Montreal, like the amount of people I've seen outside, you know just how important it is to get a little sunshine on your skin, get a little color, like move from like the gray, because I don't know about everyone else here. In the winter I turn gray, like I need to go back in the sun to look like a regular person. But that's also it's a reflection of your mind as well. Like we need we need sunshine, we need nutrients, we need movement to keep our brains physically healthy. And like you could do that in a number of ways. People think like exercise is like only going to the gym. Sometimes it's like going for a bike ride. Sometimes it's going for a long walk in an area you like. Sometimes it's playing tennis or dodgeball or I don't know, hopscotch or jumping rope, double dutch. I don't know, so many random things. And it's like I would love it if we got to a point where we didn't look at activities like, oh, that's a white person activity or that's childish, but looking at it as like, oh, this is something I could learn. Like every new thing that we try, even just learning new things can help our brains function better, help our neuroplasticity, help us just to be like more present and like physically like regulated people. But yeah, there's so many ways to help regulate your mental health.
And one thing does not always fit everyone. So, and it's okay to try different things as well, right? You may, like, I love what Annick was talking about with that journaling. It's like, ooh, you know what I mean? Sometimes you just have to put that pen to the page or, say those emotions outside, but that might not work for you. You might need to take a bike ride. You may need to do, maybe just rest, just sleep. Like, that's it. Sleep, turn off the phone. I'm going to bed. That's it, and knowing it's okay to try new things. It didn't work for you, didn't feel good. Try something new,
I think that that's a really important point. Just like if that's, I'm conscious of the time, but like continue to try until you find something that works for you. Like it's no one size fits all with mental health. It's whatever makes sense for you, whatever improves your mood, whatever elevates like the energy that you came in with, whatever makes that energy better, keep doing that. And if you're trying something that is not making the energy better, try something else. There's an infinite number of things that can help you improve your mental health. And I think continuing to try those new things, continuing to do things until you feel improvement, regardless of what other people are telling you will work, what other people have tried. I think that's what's most important, is that you are an individual and your mental health journey will be whatever it is for you.
That is such an important point. And another thing is, I tell my clients very often, I ask them to remember what they liked doing as a child. We forget to allow ourselves to be children. We hit a certain age and we say, oh no, I'm a grown up. I can't play marbles anymore. I can't play jacks anymore. Does it make you happy? But when we see a child playing it, we'll go and sit down and play with the kids. Say, oh, I remember this, and we're having a good time. Why not throw some jacks and play jacks if that makes you happy? It's okay to allow yourself to allow the child in you to come out. And we forget to allow the child in us to have fun. Look, I tell you straight now, I got 6 teddy bears on my bed and nobody better touch my teddy bears because those are my buds and they make me happy. And yes, I talk to my teddy bears and I don't care what you think about me talking to my teddy bears. Makes me happy. They're my friends and that's okay. If it works for you, do it. Remember to be a child. That's important. Look at how kids have fun. Kids do all kinds of fun things. Get down on the floor and draw if you want, or finger paint, or whatever it is. Be a kid again. It's okay. Be your own best friend.
And just to say with that, that goes for getting counseling as well. Like I cannot explain how amazing it was when the counselor said, I said, can I wear my hair bonnet to our session? Because listen, I want my hair.
Why not?
And she was like, of course. And I said, see, it's like the simplest things, you know what I mean? Can make you just feel so comfortable. So sometimes it's not the person, like Aisha was talking about, sometimes it's not the person is not going to work for you. And it's okay. You know, sometimes if you don't take to somebody, try somebody different.
Thank you everyone for the answers. We're now going to move on to the Q&A. So questions from the attendees. We're going to try to answer as many as we can. First, we have JF, who is asking, what resources are in place for Black English speaking seniors in the community, especially those who are under stress as a result of COVID-19? If anyone wants to answer, you could go straight ahead.
What are the services is the question?
Yes, what are the resources available?
Resources for seniors.
Exactly.
I think that would be a question for me, right? Okay. Well, right now, obviously things are limited because of COVID. We don't have in-person stuff, but there are a lot of Zoom things happening where with speakers, workshops that people can attend. I have an Older and Wiser series where we have different speakers once a month. Then there's there's an excellent program I think people should be aware of through the Jewish General Hospital called Tip OA, and they have phone calls. So they will do an assessment of the person, and then they will hook you with a professional depending on what the level of need is. If it's just psychosocial or actual mental health intervention. And so that's a great program. There's Quebec that has a lot of stuff online for support, especially for caregivers and individuals. And then there's Black Mental Health Connections too, of course, that has lots of resources. That's just off the top of my head, I'm sorry. You can call me if you want more, we can talk.
Thank you so much for that. Does anyone want to add anything?
Of course, community organizations. That's what we're here for. You know what I mean? Definitely those referrals, getting connected. You know, we can get you connected to people like Miranda. And of course, just reaching out and, you know, making sure that you know that there are people out there that, you know what I mean, are able to help.
Yeah, I'm still doing home visits. I do accompaniment to appointments. I do all of that. So, and can hook you up with other places that do it as well.
All right. So in brief, for seniors, check Miranda out. The next question, is by Kiana, and she's asking, how could educators better support the socio-emotional needs of our students of color during remote learning? Again, it is up for anyone.
I guess I would. I mean, for one, there's a need to believe students first and foremost. I think that's there's been this illusion around how easy this is because students are doing this from home and how much more work they can do, and transit time has been cut off and all of this, you know, there's this, I don't know, there's a lot of odd thoughts that are circling around. And I think that we need to have systems in place where we believe our students and understand that what they're bringing to the table is valid and that it needs to be addressed, that doing schooling in a pandemic is, for all intents and purposes, essentially ludicrous, right? The fact that we're in 2021 and that we can still continue to function entirely in a pandemic is pretty nuts. And we can make the best of it and continue to function, that's sure. But if we don't adapt to that in any kind of way, then what are we doing for our current, our students who are experiencing it right now, for the students that will continue to come in for many generations, and really thinking about what this is going to have an impact on our society on the long term. And I think that requires an ability to realize that, you know, educators themselves are going through something. And so if they are able to recognize it within themselves, and how do you then translate that in the way that you address your classroom, and the flexibility, really thinking about what deadlines mean, really thinking about what services are put in place for students, and all of that. And then the social aspect, and I would say maybe even social cultural, of understanding that it's okay that you don't know, but you do have a responsibility to respond, right? So if a student comes to you and says that their particular situation is making us, is challenging their capacity to engage with the classroom or their studies and et cetera, we may not necessarily understand what they're talking about. We may not even have heard of it, or, you know, it's like the amount of times that the educators will tell me, well, I didn't know that racism was still existed in this way. Well, I'm not asking you to know everything. I'm asking you to respond to the needs of the students, because that's the contract you signed as an educator, right? It's not, you didn't sign a contract of conditionally educating students till you, for only the ones that you connect to, only the ones that you feel like you understand. And your responsibility is to respond to the needs of the students. And if their needs also touch on socioeconomic, sociocultural, et cetera, and challenges their capacity to be in the classroom, then that's our responsibility to respond to that as well.
Perfect, thank you so much. Now we have some questions from the email. So what is something someone coming from outside the community can do to be an ally or a good resource for someone inside the Black community pertaining to mental health? So how can non-Black people can be better allies for us?
Oh, may I?
Yes, please.
Yes, of course.
Come to many of my lectures, Miranda. What I have some, I don't want to offend anyone, I really don't. But I have some fundamental misgivings with the whole concept of the social justice warrior. One of the problems I have with it is that too often it becomes about the person who's trying to be an ally, as opposed to being an ally with the person with whom you're trying to form an allyship. My attitude is walk next to me. Don't walk ahead of me. Don't tell me what I need. Let me tell you what I need. I don't care what you've read in your books or what you've seen in social media. I mean, I had somebody take me to task on social media. We were talking about jazz and they didn't know who I was. They didn't know I was Black. And I said, that's really cool. This person wrote me this long thing telling me that I had appropriated Black language and cool was reserved for Black people. And I was like, what the hey are you talking about? And so just because you've read something on social media doesn't make it true, and it doesn't make it applicable to everybody. Walk next to that person, find out what their needs are, take your cue from that person. Otherwise, you become another oppressor. And I'll give you an example. And you know, this whole thing around the N-word. And now you've got some school administrators say, you can never use the N-word on this term. So I was talking to a school principal. School principal, this child had been told to write something to express themselves. The kid wrote a poem. And in the space of the poem, the kid wrote the N-word, a Black kid wrote the N-word. And this teacher, the principal got all upset. And then she found out that it was a line from a Kendrick Lamar song. And then she said, oh, I guess it's okay then. I mean, you don't understand why this child was using this word. So what has happened now is that when you've got people who don't understand that that word has been taken back by a lot of our Black youth to take away the sting of it and say, this is now my word, and you can't use this to hurt me anymore. And now you're telling them they can't use it because it makes you uncomfortable. You end up bringing a different type of oppression. So walk next to them, find out what their needs are. Please do not impose your understanding of what things are on them. Be an ally. We don't need another leader. We can lead. We know our stuff. Just be an ally. Don't become another oppressor.
Thank you so much, Dr. Lashley. Kristen, you could go straight ahead.
Yeah, I think just the main thing that I try to tell allies is like, I know what my lived experience is like. I need you as a non-Black person to tell other non-Black people what my experience is like, because they might not listen to me, but they would listen to you because you look like them. That's my big ally advice. You don't need to talk to me about my lived experience. Talk to other people who don't look like me about what my experience is like. Please and thank you.
Thank you guys so much. So the next question, again from the email, is how do I best go about helping young Black youth navigate seeking mental health? What is my role as the only Black person of color at my organization?
I think like one way that could really help is like talk about your own experiences, normalize it. Talk about your struggles with mental health. Talk about like what we do with our peer support at BMHC is like we check in. And so we check in with where we're at emotionally at that point in the day, based on the day we've experienced or the week or whatever we're going through at the time. And normalize talking about what you're going through. Like just starting the conversation, going off of your own experiences, it lets other people feel more comfortable to even talk, to even reflect on their own experience. Even if they don't share in that moment, they'll reflect, okay, but actually, how was my day actually? And it's like, okay, this person is experiencing like stress and maybe depression from what they're experiencing. Like, is that something that I've been going through too? Like, allow them to ask questions, like, or explain in depth, like how you got there to your conclusion. I think oftentimes, like, we use a lot of like lingo and terms from the field, but like even just using your own description of how you arrived at that conclusion of what you're feeling. And that helps to kind of, for one, it disseminates the information around mental health, but also it normalizes it. And it's just like, even though I'm someone who, if you're a leader from your Black organization, even though I'm someone who has this prestigious position or this position of authority, I too manage mental health while I'm doing these things or while I'm being seen as successful. I too have my own struggles. And so letting them know, like, you're not alone. I think that's a huge step that could really help and would have been really beneficial to like people that I know and myself growing up.
Thank you so much, Aisha. Nadine, if you want to answer.
I'm going to put Dr. Myrna on the spot, but I think what has helped us and our staff and our people is having people like Dr. Myrna to really talk about ending the stigma of mental illness and really seeing somebody that looks like them as well, right? And so, this is my fanfare of Dr. Myrna, but just seeing somebody who's just down to earth, really talking about the profession and what's going to happen, and what does it look like, and just really, like I said, being down to earth and being open and, if you're in that position to do program development, like, implementing these workshops, implementing safer spaces, right? It can't always be safe, but we can try to work towards making it safer, in a non-judgmental, we're not prescribing anything. We're not, we're just talking about the realities and how we can go forward.
Thank you, Nadine. And finally with Annick.
Yeah, like I have a similar answer for this one and the one for allyship of these are all relationships, right? And in a relationship, there's two people. And so you need to understand the person you're engaging with, and you need to understand yourself. And so if you're understanding the person that you're engaging with, there will be cues from that relationship that you have with this youth to tell you how to best respond to their needs, right? Like, is it a casual conversation? Is it going with them to the service? Is it telling them about your experience? You already have the cues because you have a relationship with that person. And then on the flip side of having an understanding of yourself, of what's your relationship with Black mental health? How much do you know about it? Do you have access to resources? Where would you send them if you would send them somewhere? Because if we don't take time to kind of understand our own biases, our own affinities, our own, et cetera, we won't even know what we want to offer to others. And I think what I've had to do a lot of reflection for myself around Black mental health, because I'm in a position where I'm offering it to a lot of students, and realizing that there are certain aspects that I still have a lot of stigma around. And so I won't be able to give the most informed consent and informed information if I'm still functioning from my own biases and my own fears and et cetera. And so unpacking that has been really important for me, so that I can show up to that relationship in the best, with my full capacity, and also be able to attend to their needs, because I'm not just kind of focusing on my own lens.
Thank you so much, Annick. So now we're going to move on back to the Q&A questions. We have Sakina, who is asking us, first she's saying, this is a very enlightening conversation, and I'm grateful I was able to attend. With her question, she says, I often feel like resilience is expected from us. How do you think that such expectation impact our mental health in the context of the pandemic, especially for university students? So that strong Black woman or that strong Black man, and how does that impact our mental health on a daily?
I'm sorry to jump in here. I mean, but this is something that look. Resilience has two. I'm sorry, Karl. I'm sorry. It just resilience has two sides. One is an inner resilience. The other is an external resilience. The internal resilience is what we carry ourselves, where we say, we can do that. We're going to push through. We're going to take everything that's been thrown at us, and we're going to get. That's okay. That is a control issue. The external resilience is where it becomes problematic, because that's where there is a pressure put on us to accept whatever is thrown at us. Like, you don't feel pain, or you can cope with this. Oh, I can make these horrible jokes and you're going to laugh. I cannot promote you, but have you train everybody else and give them the job. And you're expected to be resilient, and people go, aren't they wonderful? They're so resilient. I want to pop somebody every time they say that, because it's sheer nonsense. And that resilience has been used, that type of resilience has been used to oppress people. So when somebody is throwing that resilience at you, you try and figure out, what do you mean? What are you asking of me? The resilience that's internal, that's one thing. But this constant, I can beat upon you, and it's such a resilient community. We can enslave them, because enslavement still continues in a different way today with systemic bias and those things. We can do all these things, and they're so resilient. Lord, we've got to stop singing bloody glory, glory, hallelujah, go to church and put in our hands in the air as though that's the end of everything. It's not. Sometimes you've got to say, stop it. As James Baldwin said, I am not your Negro. So that's what I think about resilience. Thank you for the time.
100%. Thank you. Thank you so much. Thank you so much for saying all that.
Amen.
Yes, amen. A million times over. In terms of, I guess I'm just kind of plugging our service. So in terms of Black students at Concordia, the Black Perspectives Office does advocacy support, and it's extremely important for us that we facilitate the students' ability to be students and not to have to carry all the extra loads that they have to carry as Black students. And so whether that be a racial incident that happened in class, whether that be needing to talk about any experience that they're having that they need to unload somewhere, we do that service. So please reach out. My email is bpo@concordia.ca. And we do not want to add to the external resilience. We want to empower your internal resilience, but also do the work, carry that load. And a lot of it often is this idea of kind of external resilience is because people don't want to take the responsibility to carry the load with you. And we want to do that. So please, if you're a Concordia student, reach out to us. But also in general, I think that if people are saying that, then I would throw back at them that this is not just our responsibility. And it kind of feeds into this idea of allyship, also of like, allyship is not charity. I don't know why like people have started to kind of talk about it as like, oh, I'm doing you a favor and I'm helping you and et cetera. And I'm such a good person and let me pat myself on the back and et cetera. Like, no, this is like, we have a mutual responsibility. Racism is something that we all need to address. This is not something that only impacts us. It's something that, disproportionately definitely impacts us, but it is something that is a systemic issue in the world, right? And so we have a mutual responsibility in addressing it. And so if we're being told that we are resilient and that we should kind of accept this external resilience that is being thrown on us, and then it's really about throwing it back in their court and being like, well, you know what, you also have responsibility in this.
Thank you very much, everyone. We really appreciated that. And thank you so much for answering the questions here. So we're going to wrap it up here just a little bit in this case. Thank you everyone for attending. And also thank you so much for every single one of our guests here. You have all been fantastic. Honestly, someone actually mentioned in the Q&A, the space was it's a very safe space, very therapeutic. And, it made a lot of people feel heard today, especially, me, including me, of course, and a lot of other people. So thank you very much for being here.
Thank you for having us and doing this. This was very,
this was awesome.
Thank you so much.
Yes.
Great job by you guys.
Thank you very much for having us. Really enjoyed it.
Yeah.
Thank you everyone for coming.
Well, we'd also like to say a special thanks to our teacher. Actually is here tonight. Leader, he's a teacher of our community and local activism class, Eric Chevrier. He actually gave us quite a few tools on how to go about this, and so we really appreciate that he gave us a hand on this, and let us know kind of how to go about it. So but thank you very much, Eric. May not be able to answer, he's an attendee, but he will hear it.
Nice.
Yes, so thank you. Once again, we have actually posted a few things into the group chat. So for anyone who's interested in some of the organizations of our guests here, we have posted their emails as well as the names of their organizations. And so you can find that information in our chat. And also we will be posting it to our Facebook page, to our Facebook event. So the information will all be available.
Thank you. Yeah, and please reach out. I'm sorry if I didn't answer about seeing your questions. Please reach out individually because it's very vast.
Yes, so I hope that I'm hoping our guests can stay just aside for a few moments. But to all of our attendees, thank you for attending, and we hope you have a very great evening.
Thank you, everyone.
Thank you.
So we're all watching the numbers go down.
Go down.
Okay. You want to say something?
You don't get to stick around and listen. Go down.
Oh, wow.
Technology.
My fantastic daughter was making soup, so I want to go drink my daughter's soup.
Curry, what was it? Curry chicken
Curry
soup?
chicken soup or something.
Yes.
No, technically, if she should be making for everybody.
You don't
Sharing is caring.
You don't come over anymore, Miranda. So
I'm not allowed.
I'm cutting you off the daughter list.
I am daughterless. I am.
Yes, you're always on the daughter list.
I'm still trying to get Myrna to do somebody to do that coconut bread just for me.
Oh,
I've got 20 loaves here on the table that I'm going to deliver tomorrow.
Oh goodness, how do I get on that list?
Not baking tonight. We baked last night and the night before. We're going to be baking again at Christmas when we make the rum cakes and.
Oh my goodness.
Yeah. We bake twice a year.
Wow.
That's one of the things, being your own best friend. There's a bake in it, something to do together. It's fun. And anybody who knows me and knows my daughter knows that she's the apple of my eye. I am totally in love with my daughter. Totally. That's could
So am I.
eat her all up. Isn't she fantastic? I could just
Really
eat her all up. Oh God, I love that woman.
See how long you have to wait in the car? You know what I mean? Because
I know. And you know what happened? Well, it's still going now. I had bought some soup from because I love soup. I bought some soup from Mr. Fatty. And so she went over with you to get her picture taken and then put it in 2 containers. So I ate one. And when you saw me and waved at me, I was about to eat the second one, but she thought I was telling her to hurry up. So I had to put it back in the car. And said, darn Nadine, you were supposed to keep her longer so I could eat my lunch.
I must say that's definitely a plug for anyone who doesn't know Mr. Patty's soup.
That's true.
Oh,
Yeah.
Mr. Pat. And I've known David so long and I hadn't seen him. So when I went in and I got 2 beef patties and the soup. And he said, sweetheart, I haven't seen you for so long. You don't pay today. Wasn't that a nice thing? You would not take my money. So I put a lot of money in the tip jar, but that's okay.
it's like the veggie patties. That's my thing.
Oh man.
I called, they're like, it's 1 o'clock. We're sold out. I'm like, what kind of?
You gotta be there.
Let me lay some words on you now.
Annick, I know. I was just too slow.
Time to get there. Like it's no games.
No, you don't play with Mr. Patty's patties. No.
I thought because I got in like the 3-hour window.
You thought.
Yeah, you don't play with that. Yeah. Best patties in town.
For sure.
just letting you guys know that we're going to be sending you an email shortly. So in this email, we will be asking you for your mailing address as we would like to send you something, as a little thank you. So just respond to that. You should be receiving it shortly.
That's lovely.
It's always lovely to get something in the mail beside bills.
Yeah. And it's always nice when Black people acknowledge other Black people and not just take them for granted.
Yeah. Thank you.
That's really nice.
Thank you so much for organizing this. It has been just
Yes.
nice to be in community tonight, and just phenomenal work. Thank you.
Thank
all.
you very much. I wish you
This was really
all
fun.
the best.
Thank you to you.
And stay in touch.
Here.
Yeah.
Yes.
Yeah, thank
Concordia is my alumni too, so I got
Yes.
mad love to Concordia.
Every
We actually
time I
have
see you young people, I think, well, when it's time for me to close my eyes, I'm leaving this in good hands. This is good. But I'm not going anywhere in a hurry, so don't you know that.
Better
Just
not.
so you know.
Annick, go on with your PhD. Go on with your.
Go on, girl.
Go on.
Yes.
What?
place near you soon.
Come on.
Yeah, get that thing done.
Now that I know that you're alum, I might be inviting you to come and do some talks. We're gonna have a Black grad this year, so.
Ooh, nice.
Dr. Myrna's like workshops, I have to say, like our staff and our team, they really, really, really love it. Like they really, really, really I don't think they would go if it was somebody else, to be honest. You know, so anytime you could book her.
Yeah, but when you book me for institutions, that means money. I don't do free at that. So,
yeah. I mean, everybody
yeah.
hands with me gets paid. I have a cup that says I can do your consultation when my invoice is paid.
Exactly.
Oh, yes.
Exactly.
Good evening, everybody. Thank you so much.
So much.
No.
Thank you for having us.
And can we have a follow-up? A follow-up? We should have a follow-up near the end of the year just to chat like this, because I think this is fun too.
Good luck, everyone.
Bye.
Good evening. Goodbye.
Thank you.
Karl, it's nice.
Thank you. Have a good evening.